Today we are hosting an open day. We want to show the wonderful work that we do here at Upper Eden Medical Practice. We want to speak to the patients to see if there's anything that we can do to improve our services, what they would like to see made available to them, and we thought this would be the perfect opportunity to have those conversations with them. We are also wanting to inform patients of services that are available through the practice and also that are available in the community for them to access, some of which of those organisations are actually here with us today.
So we're having an open day here at Cumbria Health for the patients of this locality. Part of our rationale for doing that is to make sure they understand who Cumbria Health On Call are, and that we're not just some temporary arrangement that have come in to sort things out because there's been a change in GPs who used to run the practice. So we wanted to raise the profile but do something really positive for this population. So part of today is about introductions, but part of today is to showcase all the really good work that goes on here at Upper Eden as a practice. So they've been through a CQC inspection recently and came out as good across all areas, and we do strive really to provide high quality care across all of our surgeries. There's been a lot in the media about access, been a lot about appointments, and we want to show the population that there's different ways to access appointments as well, and hence bringing the Melissa bus along and having staff to show how you can onboard and access your digital records, and how some of the digital capabilities that we can provide can also enhance your own individual health care.
It's a fabulous event for patients to be able to come down, meet members of the team, see how the practice works and see all the fantastic resources that they can access through their practice, whether that be if they phone the practice, they've seen a clinician or they've requested a consultation via the online app. I think it's really useful for patients to be able to meet and greet and see some of the services that are on offer, because I think then that breaks down some barriers. When they're offered those services or offered access to those services, they have more of an understanding who it is that they're being referred into.
We've also got the Melissa bus here as well, which is a perfect opportunity for patients to come and have a free health check while they're coming to visit us.
We're here supporting the Upper Eden Medical Practice Open Day. They're going to be doing some health checks, and there's various other services from the area going to be coming on board too.
I work for the Integrated Community Aging Team, which is also known as the ICAT team, and we were established about 3 years ago to work for the Eden Primary Care Network, and we cover the 10 practices in Eden. So our role is to go out and see patients at home and work out their frailty levels. The girls that work for our team are really passionate about the job, just like myself, and we want to know what's best for the patient. And it's not just a one visit. Sometimes to gain, people are suspicious, what we're doing, what they think we've come to put them into a care home. That is the last thing on our minds. It's to keep them safe. So they might have to build a rapport up with the patient and find out what their unmet needs are, and if we can support them socially as well, because we all come from a healthcare background, but some of us are social prescribers as well, so we're looking at that side of it as well.
Link is a children and young people social prescribing service, so we work with children and young people aged 5 to 19. We have a varied range of offers, so we do kind of one-to-one work, we do community-based support like drop-ins, we do school interventions, school groups. We basically receive referrals from GPs, schools, any professionals really. It's all kind of a low-level emotional wellbeing support. We work using a Bernardo's CHoC model, so that's a framework that we use, but every intervention's really individual. So we basically meet with the young person, work out where they want to be seen, so that might be school, a community, cafe, anywhere they feel most comfortable, and then we'll sort of set wellbeing goals of what they'd like to achieve and then how we're going to kind of work towards that over the course of the support.
Growing Well is mental health recovery through horticultural activity. So we're a targeted mental health service. We tend to work with people from the sort of moderate to severe end of that, and we work with people through goal-based outcomes and recovery through working in horticultural activity in our market gardens. The tea-based site is actually quite new. We've been there just short of a year now, and today is just about creating awareness in the local communities that we are there and that we're ready to help people. We have no waiting lists. If somebody needs our help, then they can be with us in less than a week from the point of referral. We're a completely free service, and we also have a free minibus that comes from Cumbria Health to take people to our site.
I help people people learn to eat well so they can enjoy more vibrantly healthy lives and feel fantastic. So I'll start off with breakfast usually with people, try and get people to think about what is a meal. You know, a meal should have some plants and some proteins and some fats, and then I'll talk to people about good fats and bad fats. I mean, everybody's trying to help people improve their health, so this is really great. People who might not access these services individually, they can come here, they can browse around, they can pick up some information. It's like a safe space and it's all very friendly and relaxed, and so hopefully people will go away with something that's actually going to be practical that they can put into their own lives almost straight away.